and sent home with a prescription for orally administered antibiotics. So by reducing the time it takes for us to provide those results, we have a direct influence on how long a patient remains in the hospital on intravenous antimicrobial therapy before they are discharged and hopefully can continue their therapy with an oral formulation of the antibiotic.
Okay, thank you. Another question that just came in. What have been the keys for gaining buy-in to the changes with your team? What has worked well, and what would you do differently?
Well, I think the most important strategy that we used, and again, this was with advice from our guide-on consultant, was to have the staff in the microbiology laboratory involved in the process. The way a traditional microbiology lab is structured, there are the individuals who work at the bench, as we call it. Those are the medical technologists. Then there's a microbiology supervisor who supervises the day-to-day operation of the laboratory. And then in some laboratories like our own, there's also a laboratory director, which is my role at Children's National Medical Center. And while it would be tempting for the director and the supervisor to take charge and make all the decisions about how a lean migration should take place, we were advised, and I thought it was excellent advice, to involve the medical technologists also, because after all, they are the ones doing most of the work. They are the ones who would be most affected by the decisions that were going to be made. And so we wanted to seek their input. The supervisor and myself came up with some ideas, but we wanted to bounce them off the technical staff to make sure that what we thought was a good idea, they also agreed was a good idea. So I think by involving them, the morale in the laboratory during our migration to a lean operation remained high, and we definitely had buy-in from our staff as we did this. So that's what worked. Now, what would we have done differently? I think in retrospect, the only thing I would have done differently is perhaps had a longer time period to discuss our situation with our guide-on consultant before we began the process, because none of us in our microbiology laboratory really had a lot of experience with lean, and we thought of a lot of questions to ask while they were present at our site, but there were some other questions that perhaps we might have asked and maybe avoided a pitfall or two here and there if we had been able to have a more steady relationship with our guide-on consultant.
Okay, thank you. Next question. How have the doctors been engaged through the process?
Well, the physicians that have been engaged in this process are our infectious disease physicians. There is a subspecialty in pediatrics called infectious diseases, and these are physicians who specialize in infections in children, and they are more knowledgeable about the way the microbiology laboratory operates than most of the other physicians at our children's hospital, who are either general pediatricians or who have chosen specialties different from infectious disease. So throughout the process that we have gone through, I have kept our infectious disease physician colleague up to date on everything that was happening and what the likely effect of those changes would be from their perspective as infectious disease physicians. And I must say that they have been extremely supportive as we have begun this process, and now we're nearing the end of the migration, and are just as excited as we are to see exactly how much benefit we will realize from these changes. We all know there's going to be plenty of benefit. The question now is, how much benefit will there be, and we hope to learn that in the coming months.
All right. It looks like we have time for just one more question. Do you think some of the changes in your lab will have a positive impact on lab safety, and in what ways?
Absolutely, I do. Working in the microbiology lab can be a hazardous experience. We deal with infectious pathogens on a daily basis. We certainly have safety rules and safeguards built in to our laboratory to minimize the chance of accidents that result in laboratory-based infection. But, humans are humans and errors are made, especially when humans are following processes that are not standardized. And so I think one of the most important parts of the lean approach to microbiology is the standardization of testing processes so that the process is well-defined in written form in our procedure manuals and also reviewed with the staff at least on an annual basis so that they are familiar with any changes to a procedure that might have taken place in the year that has gone on since the last review. By standardizing these processes and incorporating safeguards to not to prevent, but certainly to minimize the chance of a laboratory-based infection, I am confident that we will see a safer workplace for our laboratory staff.
Okay, thank you very much, Joe. It looks like we're out of time for any additional questions. I want to thank everyone for your interest and interaction during our Q&A session. And if you have any additional questions, please feel free to contact us, and we've put the contact information up on the slide, and we will certainly get you in touch with the right person to answer your questions. This wraps up our web seminar for today. Thank you for your time, and have a great day.